Welcome to another episode of Family Matters. This is a show about the family, how to live in the family, and how to go about solving the problems in the family. Now, feeling sad or blue is a common phenomenon in everyday life. But what happens when this feeling persists over a long period of time? It may lead to a condition known as depression, a condition found in 1 out of 10 people in the general population.
I have been out of campus since 1996 and I have not worked throughout. I've had periods in my life where I was not working, so I was at home with my parents. And at the same time, my peers who I finished college with were working, they were moving on in life. Going back to school, some were getting married, having children, and life just goes on, But for me, my life seemed to be stagnant because occasionally I would have a job, occasionally I'm at home, and also comparing myself with other people. Seeing that others are progressing in life, but my life, to me, didn't seem like it was progressing. Yet, nobody's journey can be exactly the way somebody else's journey is. So that affected me in a big way. And also the stress of being home and asking for bus fare all the time, asking for money to buy my toiletries. So that affected me. Sometimes I would not be in good terms with my parents. I would think they don't understand me. Depression set in. I would be withdrawn. I would have mood swings and I would be withdrawn. I don't want to mix with people. I don't want to go out. I just want to stay at home and be myself. So I think that's how the depression set in, clinical depression. I've had clinical depression, so it set in that way. One of the symptoms of the illness, you withdraw. One of the major symptoms of clinical depression is that you withdraw from everybody, from work, from everything. And I've had this from other people who've suffered depression also. They resign from their jobs. They say they don't want this job. One of the symptoms is also suicidal thoughts. You have suicidal thoughts because you feel that nobody understands you. Yes, you feel that life is meaningless and the people around you are not able to give you what you want at that particular point in time. And also, like for me personally, I was a subject of discussion in my family. So I would feel that, why are they always discussing me? Why can't they discuss somebody else? And that makes you feel unwanted. It makes you feel life is not moving at all. Life is not worth living.
When somebody is experiencing depression, some of the behavior characteristics of such a person is that they get withdrawn. That is one. Mm-hmm. Some of them go to an extent of locking themselves in the house. And for example, if somebody has a bedroom of their own, they will lock the door, they will pull the curtains. Whether it is daytime or night, those curtains are closed. Many of them like being in isolation. Like for example, if they're in a family, you will find them not wanting to have dinner with the rest of the family. They want to do it on their own. You'll find them waking up at odd hours and sleeping at odd hours. For example, somebody wakes up at 2 in the midnight, 2 in the night. And they wake up, you hear them going to the fridge, they're going to look for something to eat. And when everybody else is waking up in the morning, that's when they are fast asleep. And they are generally unhappy. They are unhappy with everything, they are unhappy with everyone. And some of them can become suicidal. Others are just angry at life, and they're angry with life. And they have a lot of blame. If you talk to them on a close range, they have somebody to blame for what they're going through. And most of them also will be in denial. They will just refuse. They will say, I have no problem. I just want to be alone.
My family, they were just tired of incidences happening. We tunakorofishana. Yeah, so it would affect the whole household. When I'm not in good terms with people, it would affect the whole family. So that's how the family was affected. Personally, I would feel like I have no friends. I just wanted to be myself, alone, lock myself in the room. So that's how it would affect me personally. And I would not have the desire or the urge to go out and mingle with people, to go out and serve in church. So in that way it affected me.
Of course it affects family setup, because someone is not going to have power to do anything. Someone will withdraw from everything. First of all, it will affect relationships within the family, because a person is going to be so withdrawn and keep to herself or himself, so that the relationships will be within the family will be bad, and the level of activity on the part of the individual will go down. Someone may not even have enough power to do what is expected of him or her in the house. Like a woman, for example, even simple household chores will become difficult, because one does not feel like wanting to do anything. If one is working, now getting up in the morning and taking a bath and putting on clothes and going to work becomes very difficult, because someone is so depressed that he or she does not feel like getting out of bed, would like to stay there. So it is a very serious type of thing, and it will make someone, depending on how depressed one is, one will become totally incapable of doing anything.
Somebody who is suffering from depression gets symptoms of loss of interest in their daily activities. They will not be interested in going to work. They will not be interested in their hobbies. If somebody liked going to the gym or liked football, for example, they will not be interested. They will have a sense of worthlessness. They'll see no hope in their future. And again, some people will have a lack of sleep, although some other people also get excessive sleep and will stay in bed the whole day. Some, when it's very severe, will get even suicidal ideas, and some go ahead and actually attempt suicide. And again, we also see another severe form where people become psychotic. They have confusion, where they will say things which are not expected with their culture and with their education. For example, they might say that somebody is trying to poison them. Their own family members are trying to poison them. Some will even refuse food from their family members. So depression has a wide range. Again, all these symptoms must interfere with their social settings, such that they are not relating well with the people they live with, or also interfere with their occupational work, the work they do, or if it's a student, it will interfere with their schoolwork. With children, they become more irritable, and their behavior will change and become violent and become more disobedient. Yes.
And the other symptoms are, I'm feeling tired, I can't wake up early in the morning, I drag myself to work, I actually don't feel like going to work, my personal hygiene is poor and I really don't care about it, I don't feel like eating, being with people makes me feel very tired, because it's a lot of energy to keep up with the society or chit chat. Or on the other hand, seeing people laughing makes me angry. Irritability, such kind of symptoms are things that people should look for, and someone who has gone through depression before is better situated than someone who's never suffered.
Being withdrawn and being unable, to do things. I know a family that the husband has been depressed for for more than 25 years. Now, I have been to that home, but I have never seen that man. because he stays in his bed. Everything, food is taken to him in bed. The only the only time he gets out of that bed is to go to the bathroom. Then straight back to the bed. Food is taken to him in bed. He takes his food in bed. So that is how serious it can be. It may make someone totally incapable of working.
Somebody who is suffering from depression gets symptoms of loss of interest in their daily activities. They will not be interested in going to work. They will not be interested in their hobbies. If somebody liked going to the gym or liked football, for example, they will not be interested. They will have a sense of worthlessness. They'll see no hope in their future. And again, some people will have a lack of sleep, although some other people also get excessive sleep and they'll stay in bed the whole day. Some, when it's very severe, will get even suicidal ideas, and some go ahead and actually attempt suicide. And again, we also see another severe form where people become psychotic. They have confusion, where they will say things which are not expected with their culture and with their education. For example, they might say that somebody is trying to poison them. Their own family members are trying to poison them. Some will even refuse food from their family members. So depression has a wide range. Again, all these symptoms must interfere with their social settings, such that they are not relating well with the people they live with, or also interfere with their occupation or work, the work they do, or if it's a student, it will interfere with their schoolwork. With children, they become more irritable, and their behavior will change and become violent and become more disobedient.
Interestingly, when I'm sick, when I have the relapses or when I'm down and under, it didn't used to affect me in terms of how the others been affected. It was just me. You're just selfish. You just think about yourself, But it would affect them. They would be worried. When they call my parents, they want to know how is she doing, and it affected them in a way, as in they were not lively the way they usually are. Yeah, but they've been strong. My family has really been strong, and I thank God.
Depression. You've probably heard these two words used almost synonymously in everyday conversation. Do they mean the same thing, or are they different? Well, let's hear what some people interviewed had to say about these two words.
Stress na depression. Huyu ndio German wetu huyu. Pana, hiyo si utaongea.
I think it's the same thing.
Kuna difference hapo kweli. It's almost one thing. Only it depends on how you take it now, but it's one thing. Yeah.
I think depression is part of stress. To me, as I understand it.
Stress leads to depression, eventually. If you're not achieving what you want to do, and you're stressed about it, and the road is blocked, you become depressed.
I think depression ni ile sana, stress ni kiasi.
I've been through stress, and so many people have been through stress. I think everybody right now in Kenya or anywhere else and I encounter stress one time or the other. Yeah, but I think I've been stressed, and I know some people have been in stress. Yeah.
Stress hasa wewe inasababishwa sana na jambo ambalo linakusumbua, limekusumbua kwa muda mrefu, unafanya kitu kwa muda mrefu akitimii, ama unafanya watu wanakusumbua mahali fulani vitu kama zile. Sana hizo ndio zinaita stress.
When for example you expected some positive results from maybe something you intended to do, for example you can say, for example I wanted to get a pay rise. I'm a bit old, about 30, and I want to get married. I have pressure from the parents, relatives, you are saying what. So that can cause stress. Yeah, so those now are the things that when they come together they start causing stress.
Stress and depression, the relationship between stress and depression can result from stress. Because like for my case, for example, I was not working. I haven't worked for a number of years, and that stressed me. asking for bus fare all the time to go where I want to go to meet my friends. That stressed me because my dad probably, or maybe he would give me very little bus fare. And I would think, why is he giving me so little and I need to go here, I need to go there, you know, but that's what he had at that time. So it could stress me. Also maybe sometimes money to buy toiletries, though I never lacked, but that could stress me at some point in time because I need to ask money for toiletries to buy sanitary towels. I would feel a lot like I'm a burden, you know, and at my age I'm supposed to be on my own with my family. I'm supposed to be independent instead of relying on others for help, you know. So stress and clinical depression are related. Clinical depression can result from stresses in life.
Indeed, very confusing two words. But what does our expert say concerning these almost similar terms?
Stress is anything that causes us discomfort. There's no more stress where we function normally within the society. Something has frustrated me, but it doesn't make me not want to move on. However, there is acute stress. Acute stress is where that I cannot function because of the frustration that are surrounding me. That is acute, and even the thought of it makes me have nightmares. That's acute stress, and acute stress can also cause acute anxiety. However, if it's not taken care of, a build-up of it could cause depression. Because at the end of the day, if every time I think about this particular frustrating situation, I feel helpless, I will learn, there's something we call learned helplessness or learned failure. I'll feel like a failure, and then slowly by slowly I'll have thought patterns that are called a set of belief system that will make me feel like a failure. Now this set of belief systems might lead to depression because of constantly reaffirming yourself that you are a failure. That can cause. However, stress is not depression. Everyone has a magnitude of stress, and we all need a different degree of stress to function and just enjoy life. Lack of it makes life rather flat. You need challenges. So stresses can be challenges, can be difficult people that we live with. But when it becomes acute, for instance, somebody who's going through trauma faces acute stress levels, and acute stress levels are like my life is at danger. This can cause to other mental illnesses, one of them being depression.
Stress is the ability of someone to adjust to daily pressures which are put onto them from the environment. For example, the pressure of being patient in the jam when you're almost getting late to work, the pressure of having to take care of your children, attend to their needs, and attend also to your own personal needs, the pressure of work, financial difficulties. We know now there's inflation, everything has gone up, incomes are not increasing, so all those are pressures. So stress are those pressures which the body faces every day. They could be physical, they could be environmental, they could be economic, they could be political. We are now almost going for our elections. We know what the fears people have about the election time. They could be social. You see, with the change of our cultures, there are other social stressors coming up with it. It is true that a lot of stress can predispose one to depression, especially if they don't handle it well, because there are ways of adapting to stress. For example, you exercise, you talk about it, you meditate, you pray about it, you talk to somebody about it, you go for counseling. Those are healthy ways of coping. But now when somebody resorts into unhealthy ways of coping, like they will withdraw and feel that nobody cares, then that can lead to depression. So stress can lead to depression, but stress is not synonymous to depression. Not everybody who will go through stress will get depressed.
Depression leads to low moods, low energy, which may lead to social isolation. This is a risk factor for suicide. Depression affects both women and men, but as our expert says, both genders deal with it in different ways.
Depression for men and women are a little different. And I think the difference is because of the makeup. When men are depressed, most of them, they refuse to talk. They kind of like get into a cocoon. They hide and they are afraid, very, very fearful, very fearful. They can never admit. If you find a man admitting that they have depression, it's 1 out of probably 10. Many of them deny.
You know, you want to release. Men don't like releasing. They don't want to know they don't want others to know that there's something which is happening. It's not good for them. No wonder they get sick so quickly, no wonder they are dying so quickly than the ladies.
Wajua mwanaume ana akili nyingi na huwa ana uvumilivu mwingi wa akili. Sasa mara nyingi anapo sort out things huwa aongei.
And because men have the feeling of they should not be defeated, most of them become desperate, and most men become suicidal.
Yes, it's true. There are more women who suffer from depression than men. But again, there are more men who commit suicide than women. So when a man suffers from depression, chances of them committing suicide are higher.
For the women, because of their nature, women are outgoing. Women like talking about their issues. Most women, when they get depressed, they talk a lot. And some of the things they talk, they become incoherent. They can say this now, and after 10 minutes they're saying something else, or they're saying just too much of something, and you begin to realize something is wrong because they are too much. They're either talking too much, and then all of a sudden again they might withdraw to themselves, and they tend to cry a lot. You'll find a woman crying. You ask her why, she will tell you so many problems, and most of the women cannot tell exactly what made them get depressed, because women are emotional. So they become very sorrowful, but most of them will not hide. Most of the women don't hide when they are depressed. They just become sulky. When you come to talk to them, they will talk with you, yes. And when they open up, they can say so much. So the difference is, I think it's in the making. Men tend to just be withdrawn to themselves, and they literally will deny. They will say, I don't have depression.
The silence in a little more depression, because what is bothering him is not sharing it out.
Hiyo kunyamaza ni mzuri kwa sababu inaweza kuzuia mambo mengi sana. Wakati mwingine inaweza kuzuia mambo mengi.
These marital affairs, they also bring stress in different ways. Either you have been very intimate to somebody, and now something cropped up, and maybe he's trying to separate. You are trying to separate yourself from it. That also brings stress.
I would say two areas especially: family and work. If you are not being able to meet, family needs of the family, starting with basic needs like food and clothing, then move on to school fees. Okay, there is tension in the house because you are not meeting you are not doing what is expected.
When I relapsed, we saw another doctor. We left Dr. Mutisya now, so we went to the third doctor, yes, who is Dr. Siengo, and she's a very lovely lady. Yeah, so she has worked with me, she's given me homework, she has counseled me, and yeah, I thank God. Yeah, I'm still on medication, so but I'm being weaned off slowly.
Feeling depressed is a part of everyday life. However, when it goes on for too long, thus interfering with daily living, it could turn out to be a problem. Learning about the symptoms and causes may be the first step towards overcoming the problem.
Depending on what support system they have, chances of somebody relapsing and getting depressed again, it's possible, because we are only human. So it's always good, and we always teach people to be self-aware and look out for the symptoms. For someone who has been depressed before, they are clear and should be clear of the symptoms of how the depression starts and the triggers. And someone who has gone through depression before is better situated than someone who's never suffered. Then once you see the triggers, notice the triggers, you notice your symptoms, it's high time you realize you need to seek help before it gets to clinical depression. Like maybe go for psychotherapy or go for a refill for your meds, because you need that to function normally in the society.
Let me talk of predisposing factors, because depression is caused by multiple factors. So you might find that this person, probably in their family, somebody suffered from depression. So their genetic makeup predisposes them. But it's not that everybody who is in a family where there was a relative who suffered from depression, they will also suffer from it. It depends on how they handle the stressors they face later on in life, and the outcome of the social support they have within them. But again, we've also seen there are certain hormones which are seen to drop in blood when somebody has depression. Again, the environmental factors, we are talking of stresses, daily stresses, and how to handle it. It has also been shown that, like, children who lost their parents, like their mother when they were young, if they do not get enough social support, then they are predisposed to getting more depression. Now, when it comes to relapse or reoccurrence of the illness, many patients who take their medication well and then they follow up appointments, they are monitored, then they live a normal life and they might not even relapse. But when you find somebody discontinuing the medication before the right time, or stopping on the psychotherapy and then they fall back to the negative thoughts, then they can have a recurrence of the illness.
My mom, since I was at home with my parents, my mom is the one who has really walked this journey with me. But she's the one who would observe my mood swings and would see I'm off the hook. Probably when I get angry at one point, I probably go above. Yeah, so she noticed that, and she had a friend who was a pediatrician, a doctor as well. So she just told her friend what I was going through, and this pediatrician friend of hers referred me to a psychologist. So that's how my journey in the treatment began. My future is bright. My future is bright. I believe God will open doors for me. I would like to encourage other people who are undergoing clinical depression. I would like to help families who have somebody who is undergoing clinical depression. I'd like to encourage them the way I was encouraged through the journey. I'm sure my parents would also like to encourage other families who've gone through what I have gone through. And yeah, I would like to give back to society, because society has also given a lot to me.
Depression is a disease that can be treated with proper diagnosis. However, lack of information has led many people to suffer in silence, or rather succumb to depression. And as we continue on this series of depression, we hope that many more people will become aware of this condition and seek treatment for themselves, and if not themselves, other loved ones like family members and friends for that case. For Family Matters, I've been your host, Teddy Onyango.
A quarter of patients who visit hospitals in the country are said to be suffering from depression and end up treated for other illnesses due to misdiagnosis, resulting to only 3 out of every 10 people taking the right medication.
A lot of people who are depressed will present with headaches, will present with stomach aches, will present with backaches, and many of our people are being treated like that. And my call to our colleagues is, listen a little bit more, take a little bit more history, listen a little bit more of what is happening to the person at the other levels, and then we'll be able to treat the mental health issues a little bit more effectively.
Every human being, for as long as you are alive, you might be part of the depressive illness.
Urbanization and transformation of family trends are marked as one of the major contributors towards depression in the current generation.
Crisis among the families, when there are crises in communities, that at those times we see an increase in depression. And I think that's why we are seeing it more. With urbanization, people don't have the normal social support networks that the extended families always gave. And in fact, if anything now, the extended family has become a stressor.
Depression is marked as one of the major contributors of disability, while other patients get depressed as a result of other diseases such as cancer.
The research done has established that 14% of global burden of diseases measured in disability adjusted life years, the so-called DALYs, is attributable to mental, neurological, and substance use disorders.
With only 80 psychiatrists in the country, together with lack of awareness and minimal financial support, handling depression remains a major challenge as the government remains on the pipeline of training more specialists in psychiatry. Henry Maina, GBS News.